The human digestive system is complex and fascinating. In this video, we explore several ambulatory gastrointestinal procedures that help diagnose and treat common colorectal conditions. Colonoscopy is an ambulatory diagnostic procedure that allows direct visualization of the inner lining of the colon. Using a flexible tube with a camera, physicians can detect inflammation, bleeding, or abnormal growths. Colonoscopy checks save lives every day by detecting polyps in an early stage and removing them before they become tumors. When a polyp is found, it can be removed during the same procedure using a snare or biopsy forceps. This preventive measure reduces the risk of colorectal cancer. Internal hemorrhoids are swollen blood vessels in the rectal lining, often caused by increased pressure from straining during bowel movements, chronic constipation, or prolonged sitting. They may result in painless rectal bleeding, especially after defecation. Rubber band ligation is a common treatment for internal hemorrhoids. A rubber band is placed at the base of the hemorrhoid, cutting off its blood supply and causing it to shrink and fall off. Infrared coagulation, also known as infrared cauterization, is a minimally invasive treatment that applies a burst of infrared light directly to the hemorrhoid. The heat causes coagulation of the blood vessels, which leads to scar tissue formation. This scarring reduces the blood supply to the hemorrhoid, causing it to shrink and eventually fall off, relieving symptoms without the need for surgical removal. An anal fissure is a small but often painful tear in the thin, delicate lining of the anal canal. It typically results from the passage of hard or large stools, but can also occur due to chronic constipation, frequent diarrhea, childbirth, or inflammatory bowel disease. This 3D visualization illustrates the exact location and depth of the fissure, helping viewers understand both the source of pain and the area targeted by treatment. An anal fistula is a tunnel-like connection between the anal canal and the skin near the anus, often caused by a previous infection or abscess. Treatment starts with identifying the full path of the fistula, including both internal and external openings. Surgery is then performed to remove or repair the tract, using methods like fistulotomy, seton placement, or the lift procedure, depending on the fistula's depth and location. The goal is to eliminate the tunnel, allow proper healing, and preserve muscle control.
Please like and subscribe, and consider a small donation in the links below to help us create more content with useful information of general interest.
Thanks for watching.